Hi, good afternoon, and welcome to today's June Learning Series webinar. I'm Kim Lair, and I'm with the CMS National Training Program. I'm joined by my colleague, Carrie Watson, who will be helping provide the training and technical assistance today. As we're between the Mother's Day and Father's Day holidays, we thought it was an appropriate time of year to talk about a role that many of us fill for our parents at some point in time, which is a caregiver. What does caregiving entail? What does that look like in the U.S. today? And more specifically, what information about healthcare might caregivers be looking for? And so to that, we welcome our guest speaker today, Karen Lindsay Marshall, the Director of Advocacy and Engagement for the National Alliance for Caregiving, who'll be presenting about caregiving advocacy efforts, research, innovations, and resources. Then Carrie and I will go into a little bit about what caregivers might or need to know about Medicare and Medicaid. But before we get started, I'd like to go over a few technical issues with you. There are two parts to today's training, a conference call portion and a webinar portion. If you've just dialed in, please be sure to join the web portion as well so that you can view the presentation and have access to the download. All phone lines have been muted so that everyone can have a good learning experience. And now let's quickly look at some features of the webinar room. If you'd like to ask a question, we ask that you type it into the Q&A box, which is located at the bottom left corner of your screen. Most of the questions that you ask will be answered during the course of the presentation, and we'll be looking at that question and answer box and either typing them in or we'll address them verbally at the end. But if any questions don't get resolved, you can email them to our mailbox, which is training@cms.hhs.gov. And don't worry, we'll have that on the slide for you a little bit later. And if you have questions intended for our guest speaker, directed for NAC, her contact information is also listed on the last presentation of the slide. Besides the Q&A box, the closed captioning pod for those, there is a closed captioning pod for those who require a text version of this presentation. And the slides for today's webinar are available for download in the pod labeled File Share on the left side of the screen. You just click on the name of the file and then download to your computer, and you can either print out or, either print out or make notes as you're following along. So on occasion, we're going to ask you for some feedback. We'll drag a new pod onto your screen, which you can either chat in your response to the question or select the answer by clicking on a radial button. And so I think with that, Carrie's going to go over and demonstrate one of these features for us. Carrie?
Great. Thanks, Kim. So you should see on your screen now a box at the top that says Chat. And what I would like to do to test this out is to just ask you, what are some of the questions or concerns you either have yourself or that you receive about caregiving? I see some people are typing. Okay. One question is, how can I find a caregiver for elderly parents who live far away? Some people don't have any questions yet. Maybe they're looking to see, well, what's involved in this presentation, and maybe I'll have questions afterwards. Are there ratings for caregivers? Daily home health care needed? That's probably a big concern for a lot. And is there specific to caregiving for elderly, or can it apply for parents with children with special health care needs as well? Good question. Are there any new caregiving legislation to help caregivers do this important job without losing Social Security benefits? How do you maneuver through the prescription maze? What support do they need to prevent burnout? Will custodial care be covered in the home? Does Medicare cover a full-time caregiver? What are the relationships between healthcare systems and caregivers? Does healthcare make referrals to caregivers? These are all some really great questions, and I think we'll be able to accomplish answering some of these during today's presentation. And certainly, we will be able to provide the resources that can answer these questions in greater detail. So it definitely looks like you all have mastered the chat box. So with that, I'm going to move that back off of your screen. Oh, let me.
Excellent. And so similar to the chat box functionality, when there's a Q&A, kind of knowledge check questions at the end, we'll drag over a box for you to select a radio button. So thanks for working with us to test out these webinar features. This is a CMS National Training Program webinar, and we're providing basic information on the Medicare, Medicaid, the Children's Health Insurance Program, and the health insurance marketplace. You should always consult the relevant statutes, regulations, and rulings for official legal guidance. I also want to remind participants that this call is intended as an informational call for partners. It's not intended for press purposes, and it's not on the record. If you are a member of the press, please email our press office at press@cms.hhs.gov. And we are also recording this webinar, and we will plan to post it on our website and learning management system within a week or two. And with that, I'll go ahead and turn it over to Karen.
Thank you, Kim and Terry. Good afternoon, everyone. Again, my name is Karen Lindsay Marshall, and I'm the Director of Advocacy and Engagement at the National Alliance for Caregiving. If you're unfamiliar with our organization, we're a nonprofit that's been dedicated to advancing family caregiving for more than 20 years. Our members include organizations, corporations, and federal agencies. Actually, CMS is one of our sustaining members, so we value the opportunity to work with CMS as a result of that membership and through our participation in the CMS Caregiving Working Group. We also serve as the founder and secretariat of the International Alliance of Care Organization. I also is comprised of 19 members and affiliate members, which represent 15 countries, all dedicated to increasing awareness of family caregivers' needs and advocating for them globally. Earlier this year, our Senior Policy Director, Mike Wickey, and our CEO, Grace Whiting, attended that body's international meeting in Paris. I was here in D.C. on a rainy day, but it's okay because I was speaking to various groups that were involved in caregiving activities here in the U.S., which is something that means a lot to me. But I mentioned that meeting in Paris because when Grace and Mike returned, they reported that those organizations were actually talking about a lot of the same issues that people who are involved in caregiver support and advocacy here in the U.S. are speaking about. So the takeaway from that is that recognizing and supporting caregivers has actually become a movement. And I personally remember not too long ago, as I was involved in grassroots caregiver education support, I often spent a lot of time describing to people who caregivers are and what they do. The next aspect of our work that I'll highlight is that we have an advocacy network of over 80+ state and local caregiving coalitions and caregiver advocates. As part of my work as Director of Advocacy and Engagement, I actually work with those grassroots advocates in my role at NAC. And just to give you a more specific idea of who those members are, these are people who maybe run local education support programs, people who work at area agencies on aging. But in all of the platforms in which we promote the needs of family caregivers, whether it's international, national, state, or local, we are a mission-driven organization dedicated to advancing family caregiving through research, education, research, innovation, and advocacy. So it's through that lens that I'd like to give you some context about caregivers' roles and experiences, as well as how and when caregivers might begin to interact with the Medicare system. Specifically, today I'll provide a short overview of how we at NAC approach caregiver advocacy. I'll share some research data to provide you with a snapshot of who family caregivers are and what they do. I'll share a tool that we developed along with other organizations who are focused on caregiving innovation that can help provide real-life insight into how and when a family caregiver might begin to interact with the Medicare system. Now, I should note that NAC doesn't provide direct services to family caregivers. So I'm not personally an expert on the ins and outs of Medicare, and I'll leave it to Kim and Carrie to delve deeper into the program details following my presentation. However, NAC's network includes many grassroots organizations, as I mentioned, which do provide direct services to families. And prior to joining NAC's advocacy team earlier this year, I was a member of one of NAC's grassroots network members. I led a Washington, D.C.-based nonprofit that provided education and support programs for family caregivers, which is probably why I had a Freudian slip earlier on when I said that when I inserted education as part of NAC's mission. But prior to that, I was also a caregiver for my parents, including my dad, who received Medicare benefits. And from those experiences as a grassroots advocate and a caregiver, I can tell you that in addition to the support that family caregivers provide their loved ones with activities of daily living, financial management, and other areas of support, in many cases, caregivers also serve as they effectively serve as information gatekeepers, fiduciaries, and advocates for their loved ones. So familiarity with Medicare basics can have a significant impact not only on their loved ones' access to needed care, but also on the caregiver's effectiveness and satisfaction in their roles. So before I go further, allow me to note what exactly I mean by caregiver. For purposes of this presentation, unless I note otherwise, I use the term caregiver to refer to individuals who provide unpaid care to relatives or friends. In other words, I'm referring to family and friend caregivers as opposed to members of the direct care workforce, which would include home health aides who may be paid to come into the home to assist with someone's care and personal daily needs, or members of the health profession who may provide care at home and in other settings. Now, the family caregivers that I mentioned are actually the backbone of the chronic and long-term care system. They sustain and support, so sustaining and supporting family caregivers is vital to supporting care recipients, and that's a theme that I'll come back to repeatedly in this presentation. And it's also why we've adopted the following core advocacy principles, which include expanding caregiver access to services and support, protecting the financial security of caregivers, and including caregivers as vital members of the health and human services system, as well as enhancing the health and wellness of caregivers. I noticed in the Q&A that popped up before my presentation began that someone had mentioned paid support for caregivers. So just to give you an example of what some of this advocacy entails, protecting the financial security of caregivers would include things like legislation that's being enacted in different areas of the country to provide paid leave for family caregivers. And right now you're probably familiar with the ability of new parents to get paid leave when they have a newborn, to take care of their newborn child. There's a similar movement to gain a similar type of paid leave for family caregivers as well. So I just wanted to offer that as an example of what we mean about protecting the financial security of caregivers. But something that's more relevant to today's discussion, though, would be by offering support such as Medicare and access to services, that actually does have an effect on the financial security of caregivers in addition to the loved ones that they're taking care of, even though they're not direct beneficiaries of programs such as Medicare. But again, I'll elaborate a little further later. I also want to mention that we published a report for those of you who enjoy reading reports. We published a report entitled From Insight to Advocacy. It was funded by Genentech, and That report inspired a summit which we held at the Yale School of Public Health, and that report examined the impact of family caregiving and major caregiving issues on public health. It also included specific actions that caregiver advocates, health systems, and policymakers can take to move from insight from acknowledging and encouraging further insight on caregivers in their respective situations to advocating on their behalf. And I wanted to mention that because from our view, caregiving has become, and this is not exclusively our view, but caregiving has become a public health issue with broad implications for society as a whole. So this slide depicts how services often overlap in terms of the ways the caregivers are served, those whom they care for, and the family unit as a whole. In a moment, I'll talk about the range of supports that family caregivers provide to their loved ones, but before I do so, I want to give you a spoiler, so to speak. According to an estimate by the AARP, the value of the supports and services provided by family caregivers is over $470 billion. But of course, discussions about family caregivers usually focus on unpaid care provided by loved ones to other loved ones. And many of these caregivers experience declines in income, either from having to take unpaid time off from work or leave the workforce altogether. And that could ultimately impact the resources available to and the well-being of their care recipients. So caregivers have financial, emotional, and psychosocial costs that impact their ability to provide care for their loved ones and to continue their own self-care. These include high out-of-pocket costs at an average of $7,000 per year. Meanwhile, the need for caregiving is increasing, and meanwhile the number of available caregivers is in decline, which is precisely why family caregivers services are needed now more than ever. So moving back to this diagram, just as there's some overlap in the needs and obstacles faced by caregivers and their care recipients, there's also overlap in the types of services that can benefit them. And the takeaway I'd like to offer to you from this slide is that in many ways the relationship between the caregiver and the person for whom they're caring is a symbiotic relationship, and that means supporting the care recipient means supporting the caregiver, and supporting the caregiver means supporting the care recipient. And that's why we see some overlap in accessing beneficial services, so that even though the caregiver may not be a direct beneficiary, if a service or support is available to improve the well-being of the care recipient, it will improve that caregiver's experience of caregiving. But now I'd like to delve a little deeper into the caregiving role by looking at data from our 2015 Caregiving in the U.S. study, which we developed and published in partnership with AARP's Public Policy Institute. This research report provides a national snapshot of unpaid caregivers over age 18 who are caring for an adult. It includes demographic information, information on the impact of caregiving, and caregiving support, as well as other information. We also published 2 companion reports as part of this study that focus on caregivers of younger adults and caregivers of adults over 50. In addition to our partners at AARP, we also worked with an esteemed advisory panel in developing this report, which included a representative from the Centers for Medicare and Medicaid Services. So I've provided the link to this report here in the slide. So if you go back and look at the presentation after today's webinar, you'll be able to click on it and go to a link to download the report and the supplemental reports if you're interested. But I just wanted to pick out some of the statistics, some of the data that we uncovered, which may be of interest to you, and to help give you a closer idea of who is caring for America's adults over 50. So you'll see that significant numbers of both males and females are caregivers. So I think traditionally caregiving was thought of as a role that was performed by women, but as you can see, men are quite often caregivers. The average age of caregivers is 50. The vast majority care for a relative, usually a parent or a parent-in-law, but they could also be caring for a spouse or other relatives, like siblings. The average care recipient's age is 74. Notably, half of the caregivers studied do not share the same household as the person for whom they care. So this segment of the population that I'm talking about right now would include people who may live down the street from a loved one, or long-distance caregivers would also fall into this category. On average, caregivers spend 24.1 hours of their time providing care per week. 3 in 5 are their loved one's sole or primary unpaid caregiver. 6 in 10 assist with medical and nursing tasks, and 43% of those studied said that they did so without prior preparation. So we'll come back to that statistic some more, but given that, it may be no surprise then when I tell you that 38% reported high emotional distress and 19 reported significant physical strain as a result of their caregiving roles. I also want to note here that we published a companion report on caregivers of persons aged 18 to 49 and a series of caregiver profile fact sheets so that you can get demographics across different populations if interested. And again, that's available using a link in the slide. And just to point out some unique areas of exploration in our 2015 report, we focused on some specific aspects of caregiving, namely the provision of medical and nursing tasks, hospitalization of care recipients, supports provided to, as well as the impacts of those supports on working caregivers. So right now, I'd like to talk a little bit more about, as promised, about caregivers performing medical and nursing tasks. So again, 6 in 10 caregivers report performing medical and nursing tasks, which would include things like injections, colostomy care, and other complex care representatives. And these tasks are more likely to be performed by higher hour caregivers who spend a greater portion of who spend a relatively larger portion of their weeks providing care to their loved ones. And they report that providing these tasks isn't necessarily easy. 14% of caregivers in general who assist with these tasks find it difficult. And those percentages rise to 22% when we're talking about caregivers who are caring for someone with Alzheimer's or dementia. And that percentage is at 21% for among those caregivers who've been caregiving for 5 years or more. Next, I'd like to take a look at care recipient hospitalization and how that affects the caregiving role. So this is a copy of a diagram which appears in the Caregiving in the U.S. report, and I don't know about you, but I'm more of a verbal person than I am a numbers person. So if you don't, if numbers and charts and these types of visual aids are not quite your thing, no worries. I'll highlight for you the takeaways I'd like to give you from this particular diagram. Over half, 53% of caregivers indicate that their care recipient has been hospitalized in the past year, and 16% say that their loved one has been hospitalized 3 times or more. Higher hour caregivers are more likely to report that their loved one was hospitalized 3 or more times in the past year, whereas 13% of lower hour caregivers reported the same thing. And taking a closer look at caregivers' preparation for providing the medical and nursing tasks that they're often called upon to perform, those more likely to say that they did not receive training include caregivers of adults ages 18 to 49. higher hour caregivers are more likely to report that their loved one was hospitalized 3 or more times in the past year. That's 22% of those caregivers versus 13% of lower hour caregivers. Additional data concerning hospitalization that might be of interest to you is that those performing medical nursing tasks are among the most likely to say their loved one was hospitalized in the past year, 61% actually. New caregivers, that is, those who've been caring for a loved one for less than a year, are more likely to report that their care recipient was hospitalized in the past year. That's a rate of 57% versus 44% of those who have been providing care for 5 years or more. And this could perhaps be due to the hospitalization event resulting in the need for caregiving. So from there, we can imagine that a significant number of these caregivers are adjusting to their roles and not necessarily familiar with Medicare or any other program for that matter that could help with the cost of hospitalization and care following discharge. And based on observation and my past work with with caregivers and with being a caregiver, as well as working with state and local coalitions that work directly with caregivers, continuity of care is a huge concern among caregivers. Now just imagine, and some of you who may be family caregivers on the line can probably identify with this, when the caregiving role isn't necessarily announced. For a lot of people, it happens with a loved one being hospitalized or being suddenly diagnosed with a serious health condition, and you're activated into that caregiving role. So you don't necessarily have sufficient time between finding out about the diagnosis, and especially if hospitalization has occurred, you don't necessarily have sufficient time between hospitalization and discharge to clear the deck, so to speak, for caregiving responsibilities. Often, family caregivers have no way to grasp the scope and extent of those responsibilities until the day of discharge. So they may find themselves scrambling to make sure that their loved one will receive proper care and hopefully avoid readmission. So as you can imagine, dealing with that, as well as the stress and concern involved when someone that you know is experiencing a serious health event, given that, getting up to speed on the ins and outs of Medicare coverage could strike many caregivers as a daunting task, especially for those caregivers who've never interacted with the Medicare system before. Among caregivers whose recipient was not in a nursing home, 1 in 3 report that their loved ones received paid help from aides, housekeepers, and others in the past year. 30% actually report receiving such help. So the use of paid services is comparable across higher and lower hour caregivers. So the length that someone has been caregiving doesn't necessarily impact whether or not they're using paid services. A significant number of caregivers look for direct care to help their families, and we can infer that this is due to reasons that range from feeling unprepared to undertake the caregiving role to needing support or respite so they can work or attend school or attend to other family responsibilities. And this data strikes me as particularly important when considering caregivers who are considering Medicare benefits in relation to their loved ones for the first time. One of the first needs they often identify, aside from meeting current expenses, is the need for a direct care worker. And it's in that quest that some caregivers often discover the difference between Medicare and other government programs like Medicaid for the first time. And it's also when they become aware of a distinction between different types of caregiving roles. Specifically, I'm thinking about distinctions between what are considered activities of daily living and what's considered skilled medical or nursing care, because whether the type of caregiving task can affect whether or not a particular program is available to help your loved one. So here, in this particular chart, you'll see an overview of the types of some of the services that caregivers use. And you'll see that requesting financial assistance is the second most common supportive service. And use of these supports or services goes up markedly once caregivers have been providing care for a year or longer. It goes up markedly for all services, with the exception of respite. That one didn't increase. So to bring a more real life and relatable view of this, I'd like to show you this figure from the Caregiving in the U.S. report that provides a spotlight on caregivers having no choice. So you may recall from one of the earlier slides that over half of those, many caregivers feel that they didn't have a choice in undertaking their caregiving roles. And I elaborated on this a little bit more shortly into the presentation about how often caregivers are activated into caregiving without any kind of warning. So over half of those who feel they had no choice in taking on their caregiving role report high levels of emotional stress, which further suggests that many in this role didn't have time to actually prepare for the role. Caregivers who feel they had no choice in taking on their role are different from those who feel they had a choice, often finding themselves facing complex care situations and increased stress and strain. Now, I should note that when we talk about caregivers having no choice, this isn't commentary on the level of fulfillment or satisfaction that these caregivers experience in their caregiving roles, but rather whether or not it was a definitive decision to become a caregiver. Supportive services to caregivers and their families can help mitigate some of the negative impacts that can arise from the complex care situations in which caregivers often find themselves. So again, we return to this idea of the somewhat symbiotic relationship between caregivers and care recipient, and how what's good for the care recipient is good for the caregiver and vice versa. So next, I'd like to give you a visual companion to go along with this data. Hopefully my tech skills will work and I'll be able to actually share it with you. But this is a link. If for some reason it doesn't work in a second, this is a link to a caregiver journey map that we developed as part of our participation in the Aging Well Hub. Oh, I think it's working. So hopefully you're able to see the same screen that I am. But this map was developed specifically to bring the data that I just showed you and other caregiving data to life.
Karen.
Yes.
I'm sorry, I didn't mean to jump in. This is Kim. I don't think everybody's seeing the
oh, really? Okay.
there. I can try if you have the link, or you want to maybe send it to me later and we can pull it up.
Sure. How about I'll send it to you later, and I'll just describe it for right now, and people, I encourage people to visit it. But I think I can give an adequate description of what it does without having to fool around with the technology. Thank you, though. So the link that is or will be provided is to the caregiver journey map, and it's a great diagram which tracks a caregiver by the name of Karen, and no, it wasn't me, even though I was a caregiver. I'm not the Karen that's being depicted as a hypothetical situation. That's actually informed by the experiences of several caregivers. And although I'm not the Karen that's being featured here, I do identify with many of these things, many of the experiences from my own personal caregiving journey. And I encourage you to go to the website and take a look at it, and specifically, if you want to make a note of this, on pages 18 and 19 of the map, you'll see a look at Karen's experience 2 years into her journey as a caregiver. So The map is set out as a timeline, and it notes different phases in the caregiving journey. The first one is usually when you begin to notice changes in the loved one that you're caring for. But where I'd like to draw your attention, if you do visit this visual a little later, is to pages 18 and 19, which talks about Karen's experience and needs, again, 2 years into her caregiver journey, which also happens to be 3 weeks into her mom's rehabilitation following hospital discharge. And it's at that point where Karen is researching full-time care options, and Medicaid and Medicare come across her radar. So again, this is just a visual companion to the data that I mentioned earlier, and it depicts and it reflects how often caregivers' entry point into applying for different programs like Medicare for their loved ones is often triggered by a major event. In this case, it was triggered by Karen's mom's entry into rehab following her hospital discharge. And it's at that point where we begin to see gaps and a lot of misconceptions in what caregivers know about programs such as Medicare. And family caregivers can navigate Medicare more easily when they're aware of differences between various programs, the coverage that's provided, and the cost. Caregivers don't necessarily, one of the biggest things we see is that caregivers don't necessarily know the differences between Medicare and Medicaid and may assume that their loved one isn't covered. I think this is especially true after hospital discharge, where conversations, for instance, with social workers may be more about Medicare because of its ability to cover its ability to address hospitalization expenses and also address skilled nursing needs after discharge. And so caregivers who aren't familiar with Medicare or Medicaid may often mentally lump these two together without knowing it, and they'll know that one program or that a program provides coverage for home health aides, and then they may be surprised to realize that they're not the same program. Likewise, they aren't necessarily aware that benefits under Medicare are more finite relative to Medicaid. And here I'm talking about the 100 days of skilled nursing care per event or illness in comparison to other longer-term care options. So it's very important, I think, that when caregivers are beginning to, and they've experienced their trigger point and they're beginning to realize that they need to apply for different programs and find out what their loved ones are eligible for, that they get education about not only what Medicare entails, but also what it does not in relation to other programs such as Medicaid. It's also very important to educate caregivers about Medicare Parts A, B, and D. They may not be aware that there are actually different components of the program that address hospitalization, the cost of providing continuity of care, and prescription drug costs. And further to prescription drug costs, it's important that they find out about the extra help that's available under the low-income subsidy, to potentially assist with prescription drug costs. And then finally, I'd already mentioned that caregivers are often not aware of what is or do not have an accurate understanding of what is and is not covered by Medicare. But also, they should know about the great publicly available resources that can help them navigate this system and begin to get up to speed on what their loved ones are actually eligible for. And so at this point, I will turn it over to Kim and Carrie to delve a little more deeply into these differences, coverage, and resources available. Thank you.
Great. Thank you so much, Karen, for all that information. And just a heads up for people looking at the map that Karen was referencing. Once we upload the PowerPoint into the webinar, it loses the hyperlink capability directly. But if you download the file, the PowerPoint file in the file share pod, that hyperlink will be intact, so you can access the caregiving map that way. So just want to give you that resource. And we know that many of you are partners and therefore are working with others to make these healthcare decisions. So in your mind, these two programs might be very clear, and it might be a little bit of a review of what Medicare and Medicaid cover and how they compare and contrast. But we wanted to really bring it up and go over it in the aspect of these are some of the things that if you're working with a caregiver when you're counseling somebody and making their healthcare choices, that they tend to get confused about. So we just want to highlight the differences now to kind of give you that perspective of if you're walking through these choices with the caregiving population. And so as Karen had just mentioned, a lot of times a caregiver falls into this situation and they kind of hear Medi and they group them into one program. But they actually are very different and have different eligibility and enrollment criteria. So first, let's start with Medicare. It's a federal program, and we'll have considerable resources at the end for what Medicare covers. Medicaid is a joint federal and state program. So there are federal minimums that are set, and then the states have a lot of independence to be more generous with their Medicaid benefits and can design and implement their own programs. So a lot of the Medicaid resources, really, if somebody's looking for more information, are very state-specific. So we'll have less resources Medicaid-wise just because it is so state-specific that we want people to check with their state. So Medicare is also intended for their eligibility is for people over 65 with certain disabilities, or if they've been diagnosed with end-stage renal disease, meaning they need dialysis to sustain life. They've been diagnosed with permanent kidney failure. Whereas Medicaid is a needs-based program. It depends on limited income and resources to see if you qualify for Medicaid. And you can see there that Medicare is the nation's primary payer of inpatient hospital services. Karen just mentioned that caregivers rely on Medicare in a lot of cases for inpatient hospital stays and covering a major portion of that bill. And we'll go into which each program covers in more depth a little bit further on. But also a reminder when you're talking to caregivers that it's not a one or the other program option either. You can qualify, and many do qualify for both programs, and you can receive benefits from both programs. And we'll often hear this population referred to as dual eligible or duals. Let's start with Medicaid. So we said this was the joint federal and state program. And you can see at the top that states are required, so these are the federal requirements to cover certain population groups. And that's low-income families, which is based on the federal poverty levels, which are re-released every year, qualified pregnant women and children, and individuals receiving supplemental security income from Social Security Administration. So those are the federal requirements that all states, in order to receive that federal matching funding to administer the Medicaid programs, have to include. But states have additional flexibility to cover additional population groups, so they can make their low-income family threshold a little bit more generous than the federal one. They can also cover these additional population groups, like individuals getting home and community-based services or children in foster care. And you have to meet financial and non-financial requirements in order to qualify for Medicaid. So we said the financial requirements are really based on your income and your requirements. And then the non-financial requirements are based on the groups of eligibility that we had talked about. You have to be a member of that population. And so because Medicaid programs are run by the state and designed by the state, they can even have different names depending on which state you're in. And the caregivers need to keep this in mind. There was a question that came up about long-term caregiving. Just because it applies in your state that Medicaid covers something doesn't necessarily mean that where your loved one might be living, if they're out of state, that Medicaid would cover the same thing. or and many times if it's a long-distance caregiving circumstance, you might be considering a move, either have your loved one move closer within state so that you can have that less frequent of a long drive to provide care, or vice versa, but be sure before moving that you consider that there are differences in what's covered in the state Medicaid programs. So now that we know the eligibility, what sort of things exactly in terms of services does Medicaid cover? And these are the mandatory state benefits. So these are set at the federal level. And you can see inpatient and outpatient hospital services. I want to draw your attention really to the nursing facility services. And the Medicaid coverage for nursing facility services really covers a couple of different categories. So there's skilled nursing, which is required after surgery, and there's the expectation that the person is going to get better based off of that skilled nursing. Rehabilitation needed due to an injury or illness. And then there's long-term care, which is associated under this nursing facility services. And that's healthcare that's really needed every day to provide assistance with basic living tasks, daily living. And so this is covered under Medicaid plans. And when we get to the Medicare comparison, you'll see that it does not cover what we call custodial care, or that long-term care piece. So that's an important distinction between the two programs. Home health services are also part of the mandatory benefit services. And another important bullet that I want to draw your attention to that comes up a lot is transportation to medical care. So this is something that's covered under Medicaid benefits as a mandatory benefit, but it is not included as a Medicare benefit. So that's something that caregivers might be inquiring about frequently as well, is help getting their loved one to and from the medical appointment. So we said that states have the option to expand their Medicaid program. So along with that, there are optional state benefits. So this is going to vary from state to state. Here are some of the things that are included: prescription drug coverage, occupational therapy, in particular, dentures and dental services, eyeglasses. These are things that we hear a lot in the Medicare program that people are looking for but are not covered. But there are an option for states to include. There are also state programs that have applied for a 1915J waiver, which I thought was particularly interesting to a caregiving population, which the state will cover what they call self-directed personal assistant services. And it's not in every state, and it's an optional one, but it's a 1915J waiver in which they'll cover the ability for a beneficiary to kind of set a budget and select caregivers and actually use that budget to compensate the people that are providing them care. So that was one waiver in place that could actually provide some monetary compensation for caregiving. And again, it's not in every state, but it's those with self-directed personal assistant services waivers. All right, so that's Medicaid. And it's really a need-based program on income and resources, and it varies significantly from state to state. Certainly when caregivers have a lot of questions about Medicaid programs, generally we'll tell them to go to their state Medicaid office, because that is really the best place. There's not one right answer. It really depends on your circumstance and the state that you live in. And so now switching over to the Medicare program, which is entirely federally run. It's for health insurance for those that are 65 or older, those under 65 with certain disabilities. And you can see on the slide there that if you've been diagnosed with Lou Gehrig's disease, there isn't a waiting period. And what waiting period are we talking about? What we mean is that if you are receiving disability payments from Social Security, your Medicare coverage will not kick in until you've received at least 24 months worth of those disability payments. So there is a waiting period, we call it, for any other diagnosis other than Lou Gehrig's disease. Or you can see at any age with end-stage renal disease. And so I wanted to just pause here and point out, because somebody had chatted in a question, is this all entirely focused, and this coverage entirely focused on those that are elderly? And the answer is no. You can certainly, Medicare can cover other populations, those that have been receiving disability payments for more than 24 months, or those that have been diagnosed with end-stage renal disease. Okay. Also important for a caregiving audience, it might look very familiar to you guys, the Medicare and You Handbook, which is mailed out every fall to homes with Medicare. You can also download it online, and we're going to go through the Medicare.gov website as a resource a little bit later on in the presentation. But for caregivers that can often be overwhelmed by the newness of their role and the legal and medical terminology that's thrown at them, this is a plain language, thoroughly tested guide that is a good introductory portion for Medicare and what it covers. So that's a good resource for a caregiver to help understand the program a little bit better. Okay, so the parts of Medicare, and we know as partners you might be very familiar with this, but again, caregivers can tend to be confused by all the new terminology and responsibilities that they're inheriting. So let's just take a quick review of the basic parts of Medicare. So Part A is your hospital insurance, and it covers that inpatient care in hospitals that Karen was referring to earlier, which triggers the caregiving role for a lot of people. It also covers skilled nursing facility care if there's a related 3-day inpatient hospital care before that. So let's say, for example, you're admitted as an inpatient for surgery in a hospital. You've been an inpatient for 3 days. When the hospital is ready to discharge you, instead of sending you right home, they might determine that you need some skilled nursing facility care, rehab, and things to make you better. And then Medicare would go ahead and cover that skilled nursing facility care because you've had the related 3-day hospital stay. If you don't have the related 3-day hospital stay, it's not covered under Part A. So that can obviously significantly impact the cost that a caregiver or somebody who's receiving the care can be looking at. And so skilled nursing facility care, let me back up. There is a deductible for Part A, and that's for each benefit period, and it changes each year. For 2019, it's $1,364, and so you would have to pay the deductible each time you receive an inpatient care, so we call that a benefit period. And then after that inpatient hospital stay, skilled nursing facility, for the first 20 days, it's $0 because you've met that inpatient deductible. Beyond 20 days is when there's an out-of-pocket cost of $170.50 for days 21 through 100, and then all costs for days after 100. And wanted to point that out because, as Karen was mentioning, it differs between the two programs, but this is the Medicare coverage of the skilled nursing facility and the cost. Also covered under Part A is hospice care, so special type of care meant for end of life, meaning that a doctor has designated that you have 6 months or less of life expectancy. And we wanted to point this out because once hospice care has been elected for Medicare, it includes coverage for respite care for caregivers, so a period of time where a private duty nurse will come in and provide the caregiving services so that the caregiver can have some rest. Also included in the hospice care benefit is things like counseling services and grief servicing for the caregiver or the loved ones of the beneficiary. And then home health care, you'll see it under Part A, and it's also covered under Part B. It depends. Some people don't necessarily have both parts of Medicare, and it just depends on your utilization of services as to which part is going to cover that. So that's Part A, hospital insurance. Part B is the other half of what we call original Medicare, or medical insurance, and it'll help pay for doctor's visits, preventive screening, lab work, durable medical equipment like wheelchairs and walkers, and there is a premium amount or a monthly payment for Part B. And so those two pieces together we really are often referred to as original Medicare. For prescription drug coverage, and I saw this as one of the chat questions as well, is what programs are available to help with drug coverage. or drug cost and Medicare Part D. As long as you have either Part A or Part B, you can also enroll in Part D and select a prescription drug plan. So certainly caregivers will want to use some of the resources that we're going to show later on about Medicare Plan Finder and taking a look at their loved ones' covered current medications, because different plans will have different tiers, and it will make a big difference in terms of your out-of-pocket costs. So really comparing your prescription drug coverage can help with the cost of drugs. Not listed on the slide, but just for reference for certainly a caregiver, there are Medicare Advantage plans, which is sometimes referred to as Medicare Part C, which essentially bundles all of these services together, and they're managed by private health insurance companies. So their cost structure can be different. They have to cover at least what's covered under Part A and Part B in Original Medicare, and most of them also include drug coverage, so Part D. They can choose to cover extra benefits. So while Original Medicare doesn't cover things like dental services we talked about earlier, a Medicare Advantage could, in fact, include that. So it's not on the slide, but again, just kind of all bundle these services together, but with their own cost structure. Medicare Advantage is known as Part C to help caregivers kind of sort through the ABCs of Medicare. So if you're enrolled in a Part D plan and you have limited income and resources, there are programs that can help pay for your drug cost. And sometimes you'll hear this called LIS, or sometimes it's Extra Help, the Low Income Subsidy. It's essentially a needs-based program that if you meet the criteria, that you'll pay either no premiums or deductibles or smaller amounts than you would otherwise. So the Extra Help program is an important resource to know for caregivers. Later on in the presentation, there's a reference to a Social Security Administration publication that is specifically written for the caregiving audience about getting extra help with drug costs. So that would be helpful as well. Not on the slide, but also if people are qualifying based off of low income and resources, there are, through the state, programs that can help pay with help with the cost of Medicare Part A and Part B, so Original Medicare, and those are called Medicare Savings Programs. And so depending on your level of need, it will depend on how much help you get paying your Part A or Part B premiums and co-payments. And that, again, you would want to contact your state Medicaid office to see if somebody would qualify for a Medicare Savings Program. All right, so we talked about what's covered, but what are things that maybe caregivers are surprised to find aren't covered by Medicare? And most dental care, long-term care or custodial care, we talked about skilled nursing facility care is covered, but that's a very specific type of nursing care. Long-term care and custodial care, which is help with daily activities, is not a Medicare, Original Medicare basic benefit. If somebody elects a Medicare Advantage plan, like we said, they can add certain benefits. It would really depend on the plan, but Original Medicare does not cover long-term care. Conversely, Medicaid has a lot more coverage in this area, so that's an important distinction for caregiving. Okay. So here are some of the resources that we wanted to make sure you were aware of. Medicare.gov, which we're going to go into in depth in just a moment here. The Social Security Prescription Health publication that I just referenced when we were talking about extra help, the link is there. Also, NIH has a National Institute on Aging that had a really helpful website with lots of different resources. The Elder Care Locator, if you're trying to find a facility for your loved one that's helpful for caregivers. State health insurance assistance programs are free Medicare counseling in every state. So if there's a caregiver that really just wants to talk to somebody and they want help in sorting through the Medicare coverage and their coverage options for their loved one, SHIP is an excellent resource for them. And the last one, the Consumer Financial Protection Bureau, that website was really helpful. There's a drop-down menu when you go there that's specifically working with older adults, and its resources really based on caregivers when they're sometimes not only managing the health care of their loved one, but then that falls into managing someone else's money, and kind of different tips and publications related to that. And there's protection of fraud, identity fraud, and also medical theft fraud tips on that Consumer Financial Protection Bureau site. Medicare.gov. So this entire website is designed for people with Medicare or their caregivers. So it is written in plain language. It is thoroughly tested. Make sure that things are as easy to understand and easy to find as possible. So it is the official U.S. government site for Medicare. On this site, you can find a lot of information. There's new Medicare card information, which is an effort that we undertook really early this spring and last year to prevent ID fraud by removing the Social Security number off of Medicare cards. You can see what's covered by Original Medicare. There's a tool that estimates the premium. So if a caregiver is looking to help their loved one enroll, like what does that mean and what is their monthly premium going to look like, there's a calculator. There are a lot of compare tools, which we actually have listed out separately. So if you're looking for quality scores on different providers and hospitals, that will all be here. There are publications. I've mentioned the Medicare and New Handbook that you can either order or view directly online. But in addition to that publication, we have several listed out at the end of this presentation that we thought would be particularly helpful for caregivers. Then you can sign up, or on the behalf of the person with Medicare, they can create a mymedicare.gov account, which really provides them a safe and secure and personalized information portal for their recent Medicare claims, and it just helps a caregiver to kind of stay track of different bills that may be coming in and what Medicare has paid by seeing the MSNs, or Medicare Summary Notices. So here are some of those publication and product numbers that I mentioned you could find on Medicare.gov. The skilled nursing facility benefits for those qualifying based off of end-stage renal disease. There's dialysis and kidney transplant benefit guide. Certainly dealing with dementia might be a part of providing caregiving services. There's a mental health benefits publication. The hospice benefit we talked a little bit about. There's more information in the publication there. And there's also the home health benefit, which we said was covered under both parts of Original Medicare. So once we talked about mymedicare.gov being that personalized portal where you can look at Medicare EMSNs and the Medicare Summary Notices, there's also a tool there to designate an authorized representative. So specifically for caregivers, you can go online and fill out a form which allows the authorized representative to call Medicare and discuss Medicare-related matters on their behalf. So that's a really important aspect for our caregivers, and we actually have the Medicare.gov page in order to create the mymedicare.gov portal and access. That's right there in the top corner on your screen. And once there, you can update your authorized representative form. These are some of the quality compare tools when you're looking for healthcare services on behalf of your loved one. You can see there's Plan Compare, which we talked about in terms of drug coverage, but also if you're interested in Medicare Advantage plan, dialysis facility, the long-term care hospital compare site, nursing home compare, and relatively new, but it can make a big difference in terms of the out-of-pocket costs. There's a Medicare.gov procedure price lookup tool, which your out-of-pocket costs can vary greatly depending on where you receive the care. So ambulatory surgical center or a hospital outpatient setting, you can type the medical code or even just the plain language version of the service or procedure you're looking at, and it will show you the difference in price depending on the setting. So for a caregiver that's also managing finances, that can be a helpful tool. And here's the caregiver publication, which we provide the link, and how to talk with a friend or family member's doctor during an office visit. Newly released this year, but certainly for caregivers that might be more likely to use their phone on the go to see what items might be covered by Original Medicare. There's a What's Covered app that you can download and access, and it essentially will give you the same information that's in that Medicare and You handbook, but it's easily accessible. It is specific to Original Medicare, so it would not apply if somebody had a Medicare Advantage plan, but as we talked about, Medicare Advantage has to cover at least everything that Medicare Part A covers and everything that Medicare Part B covers. So if it's covered by Original Medicare, it should also be covered by Medicare Advantage. But this is a very easily accessible and user-friendly tool if you're unsure of your coverage. A little bit more about an authorized representative and what they can do. And this can be designated over the phone by calling 1-800-Medicare, and there's actually an online form. So if you called 1-800-Medicare and you're on the line with your, as a caregiver, you're on the line with the person with Medicare, they can give you kind of a temporary authorized representative over the phone where you're allowed to discuss their Medicare matters on their behalf. In order to make sure that it's longer lasting, they'll instruct you to complete an online form, which is the Medicare authorization to disclose personal health information. And that, again, the link is there on the mymedicare.gov page. And here's a screenshot of where somebody could find it. This is after they've logged in, again, to that unique and secure mymedicare.gov portal that provides billing history. And with that, that's a brief kind of overview of the basics of Medicare, really trying to focus in on the pieces that caregivers might find confusing or need a little bit extra help with. And I know Carrie has a couple of questions.
Yes, so we have just 3 questions that we thought would kind of capture some of the topics we learned about today. The first one, and you should be seeing this on your screen, the National Alliance for Caregiving's mission focuses on 3 main areas. Is it A, caregiving, resources, and advocacy, B, advocacy, research, and innovation, C, research, innovation, and nursing tasks? I see everybody's putting their answers in. It's interesting, there's a little divide here between A and B. Most of you are selecting A. And the answer is actually B, advocacy, research, and innovation. A little tricky there, but just to kind of reiterate that this group is a great resource, and I encourage you to explore their website and definitely download the slides from today. You can click on some of those links that Karen was discussing and get more information. Okay, so I'm going to move over to the next question. True or false, Medicare Part B covers services to help with daily basic care such as eating and bathing. A is true and B is false. Looks like many of you are getting this one. The answer is B, false. And as you recall, this is one area that Medicare does not cover daily basic care. And there are, again, some resources out there that we've listed some on our slides, but definitely resources that may be even state-specific, depending upon where you live, that you would be able to access to help or to get some help with some of these services. And lastly, an authorized representative is a person you choose to assist you with Medicare-related matters, except for, so is it A, choosing a plan to participate in, B, providing direct care, C, gathering more information about your insurance plan or policies for research and decision-making purposes, or D, handling claims and or payments? I'll give you a moment for that one, even though Kim we just talked about that slide. We didn't go into a lot of detail on some of the specifics, but we'll see how you do. Well, it looks like you guys are really good. You got it. So the answer is B, providing direct care. So an authorized representative is more of a technical term for people who are trying to act on behalf of their loved one so that they can talk to Medicare at 1-800-MEDICARE. They can assist their loved one in choosing the plan or gathering the information from their insurance plan or policy information, and also helping them with claims or payments. So it's really, more of an authorization, as it says in the title, so that they can do those sorts of things for their loved one. Okay, so we do have some questions that came in, and I will go ahead and see what we have. And Karen, this may be something that you may have some knowledge of. If someone is looking for a caregiver and they live in another state from their parents, let's say, what's the best way to assist them in finding a caregiver? Are there certain resources that you can direct us to?
Sure, I think I can help with that. We don't endorse the National Alliance for Caregiving doesn't endorse specific caregiver referral services, but I can tell you based on my own experience as a caregiver, I was a long-distance caregiver. I live in Washington, D.C., and my parents lived in Southern Virginia. And so especially with my father, who needed more in-home care in order to age in place, it was quite a challenge trying to find out who would be able to assist them. So I would say the most effective thing for us was word of mouth. I'm from a rural area, so I could talk with neighbors to find out who their families used. That was probably the most reliable. There's also an app, and I'm on my computer right now trying to find the actual name of it, which I'm not finding. But I'll give you a description, and maybe that'll help you. And this isn't in any way an endorsement of this particular app, but there is an app that allows you to look at different caregivers who aren't necessarily affiliated with a home health agency, who can come in and provide assistance to your loved one. Pardon me, pardon me if you could hear my phone ringing in the background. So that you could ask, one, understand, you can look at their profiles and decide if they're a good match, and you can search based on location. I apologize that the name of it doesn't come on the top of my head. You can also reach out. I would also recommend reaching out to community-based organizations that your loved ones may be affiliated with, talking within their church networks. You never know if someone in the same, for instance, if your loved one belongs to a church, there may be someone in the same congregation who's actually a caregiver who might be looking for a placement. Always check in with your area office on aging. Sometimes it's called Office on Aging where I live in the District of Columbia. They're called AAAs in other places. You can also check in with them. If you're looking for this might get into a different question, and I'll come back to that. I was about to offer something on respite, so maybe we'll just come back to that.
Actually, that's perfect timing. The one question I was going to ask next is, what support do caregivers need to prevent burnout?
Yeah. So the most popular answer to that question is respite, and as a former caregiver, and I've obviously long distance, my time away was actually spent for my usual activities was actually spent caregiving. So I can sort of relate to the difficulty in taking a break from what your primary occupation or your primary focus is. And if that's caregiving, that can be a little bit difficult to step away from, because even as a long-term caregiver, a long-distance caregiver, it was difficult for me to switch gears from one thing to another because I was constantly worried about my loved one. But definitely, I think that taking breaks is beneficial, not just for the person who's doing the caregiving, but also for the care recipient. Because as you can imagine, if you're seeing the same person every day, if you're the care recipient and you're not necessarily able to get out and socialize and interact with other people, you could get tired, because I'm sure my parents got quite tired of me as much as they loved me. So respite, again, is one of those services that I believe benefits both the caregiver and the care recipient. So I would definitely encourage people to take advantage of that. And I noticed in the chat that someone was interested in programs that could help provide them with a break. And again, I would suggest that people contact their area agency on aging to find out what types of services are available. Some local offices even arrange volunteer respite providers, so you might want to look into that. There may be respite care organizations in your area that provide low or reduced cost respite services. If you're looking for a break, for instance, let's say you need to travel for business, or you're traveling on a vacation that you're not taking a loved one for whom you're caring with on, you might need to find some temporary but or focused around the clock respite care. Sometimes assisted living facilities may be able to provide you with a period of respite if that's something that you're able to do. I believe, and I'll leave it to Kim and Carrie to elaborate more on this, but I think Medicare covers respite in relation to a hospice benefit for about 5 days. But I'm guessing that the question that came up in the chat, that person was looking for something that could be used on a more recurring and periodic basis. I would recommend reaching out to local resources. I can tell you about a program called the REST program, and again, this isn't an endorsement by the National Alliance for Caregiving, but in my past experience doing education and support programs for caregivers, I was actually part of a trainer in the REST program. They train REST, and it's called REST, R-E-S-T, capital R-E-S-T program.org if you want to go to the website. They train companions, they're called REST companions, who can spend time and provide quality, reliable companionship to people in order to give caregivers a break. So you might want to go to their website and see if you can find a companion in your area. There's another resource, a book actually, and again, I have to keep making this disclaimer, but this isn't an endorsement by the National Alliance for Caregiving, but something that you might want to look into. It's called Share the Care. And the website is sharethecare.org, and it was built in connection with a book by the same name by, I believe her name was Sheila Warnock, and it actually provides people with some tips and insights on how they can create, I'll call them, I don't know if she officially calls them this, but effectively care circles within your communities and the things that you can think about and how you can go about getting your personal network together to provide care. As I recall, it was derived, the whole concept came from someone who was suffering a chronic illness and wanted to rally her friends and loved ones to be involved in her care. And they developed this sort of system of sharing the care among their group. So that's something, so there can be both formal, my takeaway, I guess, from this is that there can be both formal and informal ways of getting access to respite. Another thing, and I'll try to wrap this up, but another thing that I experienced in my time as a long-distance caregiver, my father, I should mention, had heart problems for several years, and he was eventually diagnosed with dementia. And it had been he had articulated before his dementia diagnosis that he really wanted to stay in his home as long as possible. And by that time, he was a widower. And I and my sister definitely wanted to honor that wish. So we tried our best to have him stay in place for as long as possible, but the problem was I lived 4 hours away. His other daughter, my sister, lived 2 hours away, and there was no quick and easy way to get there. He lived in rural Virginia. You had to drive. You had to tackle 95 to get down there, if any of you are familiar with Interstate 95. In any event, we looked at different options. We were not a terribly wealthy family, so we couldn't necessarily afford round-the-clock care from home health aides, although we did that as much as possible. We were looking at different options to help us help him stay in place for as long as possible before he had to transition to a different setting. And we found out about the PACE program. If you're not familiar, I believe there's a section about PACE on the Medicare.gov website. Yes, if you go to your cost and then go to the subheading Get Help Paying Costs, you'll be able to find PACE. And PACE is a Medicare and Medicaid program that helps people stay in their communities instead of going to a nursing home or other type of care facility, and it stands for Programs of All-Inclusive Care for the Elderly. And for us, my dad ended up having to, for medical reasons, had to transition to a different type of setting, but he didn't actually participate in the PACE program. But for us, it could have offered a lot of help in that during the day it would function almost like you could call it an adult daycare setting, and my dad someone would pick him up and take him to the day facility. There would be other adults his age. There would be people there who would serve him his lunch, get his medications ready for him for the day, and he would have activities and companionship during the day. And I always thought that even if I lived, and this is how it was traditionally used, people who lived in that community used it as respite to some extent, in addition to helping to delay the transition to a setting outside of the home. So if that's available in your state, I would definitely look into that. I'm not quite sure about the extent to which Medicare might offset the expenses of that, but I know in terms of qualifying and being eligible to participate in the program that you either have to be a Medicare or Medicaid recipient or both. So just wanted to put that out there for anyone who might be interested.
Yeah. Karen, thanks so much, and I'm glad you brought up PACE. It is also in the Medicare and You guidebook, and a lot of population ends up being a dual eligible population, so eligible for both. But it does, as you said, vary depending on state. So certainly they are included in Plan Finder and in the Medicare and You guidebook. Also, just to reiterate what you're saying, yes, Medicare does cover respite care, but only in the event that hospice benefit is elected. So that there is a possibility, depending on needs and circumstances, but you could pay up to 5% of the Medicare-approved amount for respite care in the event that your loved one is receiving hospice care, and it's essentially inpatient respite care. So, and the hospice benefit, once a doctor gives that diagnosis and you elect the benefit, it can be reelected. So if somebody continues to live past the original expectation, it can always be reelected and continued on. But it's not covered under the other portions of Medicare on a more regular basis, as you said. So it's under a part of the hospice benefit under Part A.
Great. Before we go to if you were going to.
No, go ahead.
If I could interject and say one more thing that's more specific about long-distance caregiving. One thing that I found helpful is to actually sit down and think about my dad's entire life. And by that I mean just think about what types of organizations, what he did during the course of his life, and from there try to figure out where I might find resources to assist him and therefore assist me. And growing up, my father was a Korean War vet, and I specifically remembered as a child, my dad did not like to talk about that very much. So I did not, and plus my dad was well into his 40s by the time I was born. So the fact that he was a Korean War veteran wasn't necessarily in the forefront of my mind, but, as he started having to have more health issues and interact with the healthcare system and needed more access to services and support, I thought about this, and so did he, that, he is a veteran. Maybe there are resources that he can get through the VA department, the VA hospital that was closest to him. And so I called them, and I didn't necessarily have to call the VA that was near where he lived. I called the VA here in Washington, D.C., and I asked about caregiver services, and they were actually able to tell me not just about Veterans Administration services, but they also gave me some guidance on Medicare and Medicaid. I called up the Office on Aging where my dad lived, even though I'm here, and I asked them different questions about services that were provided. And what I also did, and so I called the County Office on Aging, and what I also did, just in case that wasn't comprehensive, is I called the equivalent office in a neighboring county and asked them questions, and that's how I actually found out about the PACE program. So you have to, I know it sounds like a lot of footwork, but you can't really, if you're a long-distance caregiver, you really can't avoid picking up that phone and talking to as many people as possible so that you can put pieces of the puzzle together and begin to get a picture of the types of services and supports that may be available. So I hope that's helpful.
Great. Thank you, Karen. And, looking at the time, we're kind of getting close to 2 minutes to the end of the webinar, but I just wanted to say that there were quite a few great resources that were shared in the Q&A, and also just reminders, and I'll just name a few. Senior centers can be a great resource, or they have connections to other organizations that may be able to help, and the local aging and disability resource centers or area on aging. So definitely a lot of resources out there. It's just a matter of figuring out how to navigate them, which is what I think, Karen, you were referring to. And with that, if you had a question or you think of another question, you can email us at our mailbox. It's training@cms.hhs.gov. We'd be happy to address any questions you may have, and I'll turn this back to Kim.
And I just wanted to thank Karen again from the National Alliance for Caregiving. I found both your professional opinions really helpful and also your personal experience. So thank you so much for relaying all that great information and the work that you do every day to help those in this very important role. That's going to conclude today's presentation. Again, if we didn't have a response to get your question that you submitted in the chat pod, you can go ahead and send it to training@cms.hhs.gov, and that is on the screen now in our contact information. And Karen's and NAC's information are within the slides if you wanted to reach out to her separately. We're planning to have our next learning series on July 11th at 1 o'clock in the afternoon, so be on the lookout for notices about that. Our tentative topic for that is Coverage to Care, which is an initiative from CMS's Office of Minority Health. Also, for our partner audience on the screen now is a web link that will browse you to a registration site for an upcoming CMS Caregiver Workgroup meeting, which is July 31st from 9 to 11. So you would have to register if you wanted to attend that, and the web link is there on your screen. Of course, you're welcome to submit any other questions that you have to our mailbox as well. And to register or see our list of upcoming training events or recorded versions of previous webinars like the one we're doing today, and any other training materials and resources like job aids and PowerPoint slides that might be helpful for you in educating caregivers or people with Medicare, you can visit our NTP website on cms.gov or directly cmsnationaltrainingprogram.cms.gov. And with that, we'll conclude today's webinar, and thank you so much again, Karen, and those of you for attending.